Hi, I'm Dr. Nathan Stahauer, and this is an introduction to the scoring system used in the diagnostic forecasting game. Let's start by imagining that you are working in an emergency department, and a man comes in with chest pain. What's the probability that his chest pain is due to an acute coronary syndrome? The patient ultimately either does or does not have an acute coronary syndrome causing his chest pain, so it may seem strange to think about him in terms of probability. However, clinicians cannot look at a patient and know their diagnosis with complete certainty, and our choice of words ultimately reflects this. Our assessments describe patients with conditions like likely pneumonia, probable viral gastroenteritis, and possible heart failure. The choice of these probability words is important. A patient whose pneumonia is possible should get a chest x-ray. If it is highly likely, then the clinician should consider antibiotics. And if the pneumonia is very unlikely, they may not need any further workup at all. So how do we know which of these probability assessments was right? If the patient recovers well and does well without antibiotics, was the clinician who stated it very unlikely right to send the patient home? Or did they both just get lucky? One way to measure this would be to borrow a method from a field which relies heavily on probabilistic assessments, meteorology. Meteorology uses a system called Brier scoring that assesses the quality of predictions. Over time, meteorologists obtain the highest score possible by making accurate predictions without overstating their confidence in what the weather will be like. The best predictions are both useful and trustworthy. What do I mean by that? Well, predictions are useful when they provide enough information that I can decide whether to take an umbrella with me. But they are trustworthy when I don't get stuck in the rain without an umbrella after the forecaster told me there was a 100% chance of sun. Brier scores are a combination of how useful predictions are, represented by a term called resolution, and how trustworthy they are, represented by a term called reliability. We'll discuss these one at a time. Let's start with reliability. Remember, reliability is a measure of how trustworthy your predictions are. Reliability measures how well predicted probabilities match up with reality. If you take all of the days where a reliable forecaster says that there's a 40% chance of rain, it should rain 40% of the time. We can visualize reliability by plotting predicted probabilities against observed probabilities. A reliable forecaster should have data points which fall close to the orange line. But reliability isn't all there is to it. Imagine you're told that on average your hometown gets rain 20% of the time. If you predict a 20% chance of rain every day for a year, and it rains an average of 1 day in 5, you would be perfectly reliable, but you wouldn't have added any information to the situation. A good forecaster can recognize days when the likelihood of rain is higher than average, and days when it will be lower than average. This makes their predictions more useful. The ability to separate high and low probability cases is called resolution. Imagine two forecasters. Both know that on average there's a 20% chance of rain on a daily basis. Forecaster 1 is a student studying meteorology, and forecaster 2 is an experienced meteorologist. Forecaster 1 recognizes that some days have lower and higher likelihood of rain, but because of his lack of experience, he needs to hedge his bets a bit more. He assigns the less likely days a 10% chance of rain, and the likely days a 40% chance of rain. Forecaster 2 also recognizes days with higher and lower likelihoods of rain, but because of her expertise, she can recognize days with very low probabilities, 5%, and very high probabilities of rain, 60%. The extent to which these forecasters can accurately differentiate likely and unlikely events from the average rate is called resolution. Brier score is a combination of these two factors, reliability and resolution, together with a third factor, uncertainty, which is inherent to the difficulty of the data being predicted to generate the Brier score. The actual Brier score is like golf, a lower score is better. Let's go back to the emergency department. Now imagine that you have 4 patients, all of whom have come in with chest pain. You know that overall, 25% of the patients who come into your emergency department with chest pain have an acute coronary syndrome. As it turns out, only one of these 4 patients, the one in the red box, is having an acute coronary syndrome. Now imagine 3 clinicians: a cautious medical student, a resident, and an experienced physician. The medical student knows they don't know much about working up chest pain, so they hedge their bets and assign everyone close to the base rate of 25%. Since 25% isn't low enough to safely exclude coronary syndromes, the student gets full cardiac evaluations on each patient. They might be overusing tests, but at least they are realistic about the limits of their knowledge and don't miss any coronary syndromes. The medical student here has high reliability, but low resolution. The resident has learned to recognize low-risk atypical chest pain, but they overlook the fact that coronary syndromes often present atypically in certain populations and assign patient B a low pretest probability. The resident's reliability is poor. In this case, the resident uses fewer tests than the medical student, but also misses a critical diagnosis. The experienced physician recognizes that both patients B and C could have coronary syndromes, and both need further evaluation. They use fewer tests than the medical student, but are still able to catch the patient with the acute coronary syndrome. In this case, the experienced physician has better resolution than the medical student and better reliability than the resident. Here are the Brier scores for our 3 clinicians, scaled to a maximum score of 100, where a higher score is better. Now you're ready to try your hand at making some clinical predictions. The diagnostic forecasting game will give you a series of real cases, each of which will have 3 steps. First, you'll get a brief case description. Based on the case described, assign a probability to each option that's given to you. Other will always be the last choice to reflect that there are always other possibilities that we have not specifically mentioned. On many cases, other will in fact be the correct diagnosis. Well, in real life, patients often have more than one diagnosis. For the purposes of this game, we have selected only cases where precisely one answer is responsible for the patient's presenting symptoms. Therefore, your probabilities should add up to 100%, and the app will make sure that that's the case. After assigning probabilities, you will choose whether you need additional tests in order to arrive at a final diagnosis. You can select tests in a number of batches. You can select as many as you want and then get to see the results of those tests. You can then decide whether to order more batches of tests or instead proceed to make a final diagnosis. Once you have enough information that you feel you can confidently make a final diagnosis, you may choose Make Final Diagnosis, and you will select from among the original diagnostic options. If your answer is Other, we will ask you for the name of the diagnosis that you suspect. After each question or set of questions, you will see feedback. You'll see a forecast score that you received on the questions which you just completed, and your running reliability and resolution scores. Here, all of these scores have been scaled to 100, with 100 being the best possible. The reliability and resolution scores are provided to give you some hint as to where you may want to improve. For example, if your reliability score is much lower than the expert score, your predictions might be too strong, and you might improve your forecast by making your predictions more cautious. There's no gold standard, and you can always seek to improve, but we have provided scores from experts who completed these cases so that you have something to compare yourself against. At any time, you can find your updated total forecast score by going under the Programs tab and selecting the program that you started off with. So, your objectives in diagnostic forecasting. First, obtain the highest overall forecast score. Remember that you might lose points on individual questions, but over time, you'll get the best possible score by accurately describing how certain you are about that patient's diagnosis. Along the way, try to use the fewest tests possible and the fewest rounds of tests possible, while still making sure that you get the right final diagnosis. Have fun.